Hello, and now to something completely different. My name is Mark Stahl. I work for the Global Risk Forum in Davos, and I'm going to talk a bit about the One Health approach and how this can be linked with the post-FHA process. The One Health or the One Health approach is an approach that is based around health, of course. Health is very important for everybody. Actually, when I was a kid, I thought I'm immortal, but ever since I realized that I'm not, health became more and more important to me. And if you're a family parent, I mean, you want your kids to be healthy, you want your kids to have food. So I think for humans, health is a key component of our daily life. Well, not only for humans, also for animals, health is important. Studies have shown that animals actually try to keep themselves healthy, and they use plants not just for nutrition, but they also use it to fight parasites or help with pain that they're having. So this is a capuchin monkey from Costa Rica, and they are known to use the piper plant, which is a sort of a chili, and they rub themselves in with it to fight parasites and to deaden pain. So for humans, health is important, but also for animals. What is also important for human health is ecosystem health. We are all dependent on ecosystems. Ecosystems provide us with nutrition, but they also provide us with food services. They filter water. They provide us with biodiversity. Biodiversity is important for medicines and medical development. So ecosystems and ecosystem health is very important for us humans and also for the world we live in. Plus, the term resilience is basically based on biological systems, talking about the resilience to absorb shocks and keeping their state. Talking about ecosystems and provision of food, we've got food security. Food security is a major issue in the world. We have to fight hunger. This is about food security, but also food safety is important to human health. We can talk about genetically modified foods and what are the risks with that. Or about lifestyle diseases such as obesity or heart attacks. This is something that is also connected to food safety and for us. Or antibiotics in animals, which are risks that are also connected to human health. Water, access to safe drinking water. Actually, still 900 million people don't have access to safe drinking water in the world. And 10% of all the diseases that are caused are based on water, contaminated water, or on hygiene problems. So this is also an issue for human health and for health as it is. And I think it is fair to say that health is a very complex socio-economic system, socio-ecological system, with many determinants such as food and agriculture, such as the environment, fisheries, wildlife, livestock, public health, but also DRR, poverty, and so on. So health is a central role for living things and for human beings. And basically this is what the One Health approach is trying to touch upon, the interconnectedness of human health, of animal health, of environmental health, of agriculture, and of food safety and security. The One Health approach tries to patrol these interfaces and tries to look into the connections that these various determinants have with each other, and focusing on health as a central role. So examples for One Health and the interconnections with that is, for example, the avian flu or the H5N1 bird flu, where that caused significant problems. Many people died, and it was coming from livestock to wildlife to humans as a disease, which caused problems. As well as SARS is an example, therefore, where the connections between animals and humans are quite quite drastically seen in health impacts. Hendra is a virus and another example for One Health and the interfaces. Hendra is a virus that is actually coming from bats and bat populations, so from wildlife, which is then, and the bats can live with the virus without problems. But the bats transfer this virus when they're to horses, and the humans that are actually working with the horses are being infected, and the death rate is about 60%. Whilst being infected with the Hendra virus. This was a problem that was, or this was a risk that was identified in Australia, and there was sort of a One Health task force came together to deal with that problem, and there were wildlife specialists talking to veterinarians and talking to human-animal experts, human experts or human medicals. And looking into the problem that is arising and then seeing what could the solution be. So the first idea was maybe we should look that the bats are not around the horses, so they can't be infected, which would just push the problem to another area. A second idea was to actually develop a vaccine for humans to fight the virus by themselves with a vaccine, which normally takes 10 years to be developed. So this task force came up with the solution that they should develop a vaccine for horses, and therefore the wildlife is still protected, the horses are being protected from the virus, and the humans are also being protected from the virus. So this is quite an example on how a One Health task force has been identifying the risks that are between these interfaces and have dealt with it. But talking about natural disasters, there are also connections between health, a disaster, and, for example, contaminated water, which is when the feces of humans or animals are in the water and people drink that water. Cholera outbreaks are a major problem after floods or after earthquakes. And this is a cholera protection site in Haiti, for example, in this picture shown. So there are different interconnections also with DRR, where the interface between human, animals, and the environment is important, and the interconnectedness is there. Climate change, on the other side, is also a factor within this One Health concept. Climate change is being said to have new breeding grounds for parasites that actually can transmit diseases. So malaria, for example, is one issue. So the climate change also has its impacts within the One Health approach. So a risk-based One Health approach where health is actually in the center of a risk assessment or a risk analysis could be a useful approach for looking at these interconnectedness. And actually asking the question, how safe is safe enough? Is an overall risk idea that all DRM people working with. And to talk about risk assessment, what is acceptable to happen in these interconnections, what can happen, and what has to be done in order to take the measures that needs to be taken. Always looking at the One Health, or always looking at the health and the interconnectedness of these health links. So this concept, the One Health approach, has already been acknowledged by, for example, the Food and Agriculture Organization, the World Organization for Animal Health, and the World Health Organization, thank you, that have formed the tripartite. So there are already international agencies working on this, but there are still challenges that remain. So, for example, what is an investment framework? How can we invest in this One Health approach? Or how is the work being organized between all these organizations working on health, working on veterinarian health, or working on human health? So these are still issues and still challenges that have to be tackled. And it has been argued that the HFA, so with its priority actions or with its priority areas, could be a useful approach for the One Health community to look into how to build the institutional capacity, how to know all the risks and all these areas. But looking beyond 2015, we've got the MDGs that already have different health components in it. The Yoga Framework for Action. One can use synergies between the HFA and the One Health approach, and for example have health as a component within the post-HFA agenda, and use, for example, livestock as a factor in the post-HFA new agenda, or use health as an indicator for monitoring and for outcome evaluation. This could be a synergy that could be used between these different frameworks, and a useful input could be provided by the One Health approach. Basically, the One Health approach has been discussed by a summit that the Global Risk Forum has organized, the One Health Summit that took place in 2012 in February, and the short presentation is basically from the outcomes of this event. There's going to be a next One Health Summit in 2013 in November from the 17th to the 20th, again in Davos, and the call for abstracts is still open, so if you think that you could contribute to this, please go to our website, the GR Forum website, and submit your abstract to that. If you have got more questions or you would like to have more information about the One Health conference or the summit, we have a booth here, booth number 1 at the entrance for the registration. Please come by and talk to us about it. Thank you very much.